Welcome back to PHAMCAST, everyone. I don't know about you, but what an episode this has been. Back here with Dr. Rallis. And check this out. When oranges become apples, what your oncologist won't tell you about IV vitamin C and cancer. Congratulations, first of all, on this book.
Thank you.
And I cannot wait to dive in and talk about, you talked in the last segment with Dr. Prowse a little bit about IV therapy and the importance and the difference it is. But oncology is in your wheelhouse and something you're passionate about. Let's dive into this book, The Why, and helping those, and I've got many patients right now that are going through cancer treatment. You're here to serve. How can this help?
There may be no place greater than in oncology where IV therapies shine. And in particular, there are IV therapies like high-dose vitamin C, mistletoe, alpha-lipoic acid, etc., that have particular utility in cancer. And utility in cancer in very remarkable ways.
Okay.
And the reason this book is written is because these are therapies that, when coupled, especially as part of a metabolic treatment plan. When we say metabolic treatment plan, we mean cancer itself, tumor, the cells, have a very unique metabolism, which is different than our normal cells.
Right.
And the standard of care in oncology and conventional medicine is really focused on those daughter cells, the highly, replicating tumor cells, and eradicating those, which is good. That is great news. However, what underlines the cancer, from the stem cells to the metabolic nature of the cancer to the adverse effects, all of those are treatable. Where this shines is in things like supportive cancer. So patients don't know this.
Right.
So I'll give you a good example. A patient is undergoing chemotherapy for a highly glycolytic, a highly aggressive cancer. The chemotherapy is oxidative, which means that it creates reactive oxygen species, so the opposite of so when an oncologist hears the patient may be going for IV vitamin C, they don't know a lot about IV therapies, but what they do know is, wait a second, in medical school, I learned that vitamin C is an antioxidant.
Right.
This patient's life is at risk. I'm administering a chemotherapy which is oxidative, and they want to go and get treatment with this joker who's going to do IV vitamin C, which is an antioxidant. Not only is he administering an antioxidant, but he's administering it in the most effective way, which is as an IV. That's crazy.
Right.
And what they don't know is that vitamin C, when administered at high doses, becomes oxidative, changes to hydrogen peroxide, and begins to, I'll take a classic example. That tumor cell is partially kept alive because of its level of antioxidants. In other words, it's glutathione stores. Glutathione is the body's primary detoxifier, our body's prime antioxidant. Same for the tumor cell. So that glutathione, oftentimes the chemotherapy is not as effective as it could be because the glutathione stores can't be shrunk in order to create a cytotoxic effect and kill the tumor cell. High-dose vitamin C, when administered before the chemotherapy, completely depletes that tumor cell, it's glutathione, making it far more likely to be killed by a much lower dose while protecting our normal cells. Because vitamin C at high doses, again, is selectively cytotoxic, unlike chemotherapy, which is toxic to all our cells, healthy or abnormal.
Right.
And our medical students and I, through Trinity School of Medicine, engaged in this research project, exploring. We wanted to answer the question. I knew from in my practice and from the research that was out there that we were seeing an enhanced effect with high-dose vitamin C and with cancer. In other words, patients were getting better outcomes. One thing we know about cancer is it's so well defined. We typically know if a patient has cancer X, an aggressive cancer, let's say pancreatic, KRAS positive, colorectal cancer, or glioblastoma, we almost know exactly how long they're going to live.
Right.
So much so that when I was in the US last weekend, we see drug commercials for this new blockbuster drug that gives a patient 4 extra months.
Yeah.
Right? So the time frames in this disease are very well defined. So when we start seeing patients blow past those timelines, just like the original Linus Pauling studies in the late 1970s, over and over again, you realize it's not a coincidence.
Right.
And that more patients need to have access to this. So we did the research, and what we found was what we thought we would find. That all the studies that were done, all of the meta-analyses that were done, high-dose vitamin C, when coupled with chemotherapy, not only didn't adversely affect the chemotherapy, it was synergistic.
Wow. Powerful.
Which is what we would expect. Again, from a functional medicine perspective, if we know that it is depleting glutathione stores, if it's addressing the stem cells, if it's pushing that tumor to its oxidative limit, when chemotherapy rolls in, it has a far easier ability. And book was written to provide research, rationale, and I tried to write it in a way that was very amenable and understandable.
Yeah, because that's really important. I think there's, as you see this, and I've certainly seen it in my practice when I've done some oncology work, there's a lot of fear. When you hear that word, the fear goes up, and you don't know where to turn. And
No.
And you need that. You need to have simple understanding so you can advocate and not just be told what you just said. Well, this guy's crazy, right? An oncologist is going to look and say, well, what do you mean? You can't be given IV vitamin C. Thank you for doing something like that. That's really important so that the average everyday Canadian or North American has a tool so they can start to have some agency and conversations with their physicians about this.
Yeah, and in Margaret, your work too, you've been a tireless promoter of empowering patients.
Yes.
And the doctor's job as servant is not just to provide a service, but to provide a level of information such that they can also empower the patient to make an informed decision.
Mm-hmm.
The decision that's right for them.
Yes. And
when fear takes over as the primary talking point, or when authority is held over a patient's head to induce fear, the likelihood of making good informed decisions goes out the window.
I couldn't agree more. And
there's nothing more fearful than the other.
Yeah.
So therapy I don't understand must not work.
Correct.
Therapy that I wasn't taught in medical school
can't have validity. Yeah.
Well, guess what? 20 years ago, what we learned in medical school is not the same anymore.
100%. And I want to also say, because I have many friends, as I'm sure you do, that are working in conventional medicine, that are brilliant people, that are doing their best. It is not their fault the way they're being taught. It is not the fault, the strain on the system, the time limits and constraints and resources that they have or don't have. But this is why these conversations and this FAM movement is critically important, to have these honest discussions. And I said this to both you and Dr. Prowse off camera, and I am so beyond proud, not just of this movement and empowering Canadians, to be the CEO of their health and have agency and empower them to be an active participant. But what's been really humbling to watch, and what I'm most proud of, is the connections, and you alluded to that with Dr. Prowse, the connections that this movement is making in breaking down the silos and connecting practitioners from both allopathic and complementary medicine to learn and grow from one another with one thing in mind, which is to help the patients that we have the privilege of treating. And hearing you so candidly speak, we're not putting down our colleagues, in conventional medicine. I mean, this gentleman is doing medical rotations, the first ever, which I think is fascinating and wonderful, because that's how we create change. And if we all put ego aside and we're willing to learn from one another and be open to changing the way we look at healthcare and at medicine, as you say, functionally, it's a living and breathing thing. That is what's going to create legacy change.
Yeah. 100%. And this idea too that, and you touched on this is about putting your ego aside.
Yes.
It is about having humility.
Yes.
And knowing that what's most true now isn't the gospel. And science is also a living, breathing thing.
Yes.
And hopefully we will know what is more true in 5 years and even more true in 10 years. And I think that we have to move. And that's a question that I asked one of our students that finished his medical rotation yesterday. And he said, this is really about education. And it is about, to your point, removing the silos.
Yes.
You know, these sort of arbitrary lines in the sand.
Uh-huh.
And, you know, our colleges are also guilty of this.
100%.
You know, and you know
100%, yes.
And there isn't anyone that doesn't gripe with their college, partly because they talk about integrating, but they so tightly want to keep everybody in a box. Yes. But the moment that oncologist has the courage to look outside of that box, he's then cascaded.
You know what? Absolutely. In my profession, and I am proud, I say this, a proud registered massage therapist, but there's so much fear in our profession. Oh, stay within your lane. That's out of your scope of practice. I'm not ever pretending to be something I'm not. I am not a physician. I am not a naturopath. I am not a chiropractor. I am a really clinically sound registered massage therapist with a background in kinesiology and all kinds of other things layered over top. I'm also a human being who's had my own life experience and ran a clinic with all kinds of people working together. And what that has taught me and why I'm so proud, and you saying it so candidly, which is what I love about this opportunity, is that that we got to get rid of that fear, because I'm not doing anything out of my scope, but I am bringing people together to talk and learn from one another, just like you did from Dr. Prowse, and Dr. Prowse has learned from you, and I'm going to learn from you, and you are learning from me. That is what allows patients to have options to consider so they can make more informed decisions of their health. And there isn't one, personalized medicine, there isn't just one solution for every patient like this. It's crazy how it's very defined. Well, is medicine really that defined?
No.
Person to person?
No, because it's if you center, if the central idea is around the patient, then it's about treating the patient, which means about care. Right. Care is about feeling.
Right.
You know, that's why I always say good doctors treat patients, not diseases.
Yes.
I'm lecturing at Parker University end of March, and they wanted me to present on anxiety. Sort of this I was in the functional medicine rotation and functional medicine stream in my lectures on anxiety. So I thought of this case that I had 10 years ago almost, and it was a young mom, 5 and a 7-year-old, came in with severe anxiety and OCD. It started as a germophobia. Got to the point where she could no longer hug her kids, touch her husband. She was essentially a prisoner in her own skin. I knew very little about integrative and functional medicine in terms of psychiatry on any level. I'm not a psychiatrist.
Right.
And even my understanding of functional medicine tests for brain function and neurotransmitters was not what it is now.
Right.
So I wasn't even looking at folate and zinc and copper. I looked at some very basic things, but I knew enough to listen, to care. She felt validated. Mm-hmm. I did a B12 injection, believe it or not, which a methyl form of B12. And looking back now at her numbers and her markers, I realized she was an undermethylator, so I actually happened to be lucky and pushed the neurotransmitters in the right direction, because I could have made her worse. But me caring for her first was the first step.
Yes.
Me listening, and I said, what's your goal in care? She said, I would like to be able, it's just emotional too, I'd like to be able to hug my son for his confirmation.
Oh.
And she did. And I remember when I could first put my hand on her, and I remember when I first hug her. Oh, and then you get a message from your college, we really shouldn't be touching patients, hugging patients, loving patients.
Hi.
But how can we possibly care for them?
Right.
And how can we possibly heal them?
Right.
And you know that because you have had the privilege of putting your hands on someone, and you understand what that sacred space is.
And I don't take it for granted.
It's that space, and I tell this to our medical students when we're doing examination, because I'll see them do something.
Yep.
And I said, that is sacred space.
Yep.
And it's an honor to be in that space.
You betcha, and I use that word often. It is an honor. And you know, we both have experienced that. Thank you for sharing that story, because it'll resonate with so many, and it's a real story for most people in healthcare now. And that's why these conversations are so important. It has been such a pleasure having you here today. This is just the tip of the iceberg. I mean, I'm sure all of you at home listening and watching are going to want to have Dr. Rallis back on PHAMCAST. I cannot wait. As I said at the beginning, I've got a signed copy, and I cannot wait to dive into this. I'm also going to boldly, I haven't asked this off camera, but I'm going to do it now anyway. And I'll buy one if I have to, but I'd love to give one away during Preventative Health Month, and maybe for some of our viewers, because more people need to get their hands on this. And yeah, so we'll get you to sign a couple before you leave. I'm saying it on camera, so you can't say no. Thank you for, not only just being so honest about your story, but also being bold enough to speak up, because I know when we link arms and we're better together and we boldly push up, like you said, people get ostracized in their profession because you're talking out of line, but it requires boldness. It requires change, and we all have to be part of that change if we're going to change the legacy of healthcare for our kids and future grandkids. And I know that you're already doing that, and what an honor to have you in studio today.
It's an honor to be here with you.
Well, that's another incredible episode of PHAMCAST. I got to tell you, I learn every day from the people on this show, from this movement. My heart is full, and stay in touch with us. If you have questions, or if you want to reach out to Dr. Rallis, please have a look, but tell us what you want to hear about next. And remember, a healthy tomorrow begins with prevention today. You are the most important member of your healthcare team. Stock your toolbox. And until next time, be safe, be well, and we'll see you all soon.